helping you lead a healthier life. This is CURES.
Hi everyone, welcome to the CURES Show, where we explore the cutting edge of wellness for our mind, body, and spirit. Anxiety is one of the most commonly diagnosed mental health conditions. And when it comes to treatment, it certainly can be hard to know what's really the best, and are there any holistic options where you could try first? Well, Dr. Jennifer Stagg is an expert in that, and she is joining me now with a holistic approach to anxiety with some natural therapies that really, really work and that you've helped your patients with. So thanks so much for being with us.
Yeah, thanks for having me.
Yeah, so anxiety, I guess if we're going to define it, it's just that general feeling of angst and worry. And even if you don't have an official diagnosis, you might really be struggling with just feeling that all the time.
Yeah, for sure. So anxiety can come with like emotional symptoms and or physical symptoms, right? So the emotional symptoms could be more like generalized worry, ruminating thoughts that you have difficulty getting rid of, and that can come in varying degrees of severity. And then, you could start to have some problems with physical symptoms like difficulty sleeping, heart racing, the feelings in the body. And so when we think about treating anxiety, you have to really get a good gauge of all the different symptoms that someone's dealing with to come up with the most effective treatment approach and plan.
Yeah, and the thing is, sometimes when you have those physical symptoms like racing hearts or that, people will think I'm having a heart attack, and then they find out, oh, I just had a mild panic attack.
Yeah.
So it can feel similar, but either way, so many people maybe don't get help, and they think I just have to live with this, and they might be really irritable or not sleeping well, snapping at people, just not living at their full life. There are holistic remedies that really make a difference for people.
Yeah, for sure. There's a lot of research-based approaches to treating anxiety. And first of all, we really think about doing a really good physical exam and blood work checkup to make sure it's not something else, right? Like sometimes someone might have a thyroid problem, like maybe they never even had anxiety symptoms before, and now they have like a high hyperthyroid, and that could manifest as heart racing, feeling jittery, and it's actually a thyroid problem, not anxiety.
Okay.
Or kidney problems, where you have to look at everything, rule out any potential medical causes first.
Okay, so your first step is it would be great to get your blood work, and a lot of times your regular doc may not be getting all the tests that you would do if you're concerned about anxiety. Let's start there, and then we'll talk about some of these great supplements that you could just buy today that might actually start helping. But if you're going to your regular doc, what are maybe some of the Quest tests that you could add on that could give you a clue if you're deficient in certain things that would affect your mood?
Right, so in addition to just basic screenings like metabolic panel, thyroid, and blood cell count, then I would start to think about nutrient testing. So checking omega-3 levels, that has been associated with higher risk of anxiety when you have low omega-3s, but also vitamin D and magnesium are tests to think about. Folate is something interesting. So some patients who have anxiety and also depression can have genetic variants in a folate gene that allows us to have this active form of folic acid. So then supplementing those patients with this active form of folic acid called methylfolate case studies have shown that to be really effective for both anxiety and patients with depression. So really looking at all those nutrients is an important place to start.
Okay. So yeah, I mean, in my own experience, we learned that I was low in B12, and I think maybe I did have some issue with methylation. So,
yeah.
So that would mean, so if you're feeling, and especially it can be hard for moms right now because the kids are getting out of school and all the changes are happening, and teens as well. I mean, maybe some of them are going to be less anxious because school's over. Others might be having too much screen time, and we want things that are accessible and safe. So what would be step one if you could start taking something now to figure out how does this work for me, and can I just notch down the anxiety?
Yeah, so if you're starting kind of at a lower level and you have sort of mild anxiety and maybe there's some stress associated with it, I probably would start with magnesium as the main supplement, which is really safe to take at all ages.
You've got one here.
Yep.
This is from Whole Health, so this is your own at your office, which is right in Farmington, Connecticut at Whole Health, Mag Relax. And again, this is something that you can get over the counter. If you're going to buy it yourself at, say, a Whole Foods or something like that, what are we looking for?
Yeah, so I like to use magnesium glycinate as the form, especially for anxiety, and that form means that it's chelated to glycine, and glycine is a relaxing amino acid, so it gets better absorbed, but it also has like another ingredient essentially that will help maybe calm the nervous system a little bit more.
I know this helps me sleep better. I can tell if I forget to take my magnesium at night, I don't sleep as well.
Yep, yeah. So this is the same form we think about. I think we've talked about this before, that this is like the form for sleep too.
Yeah.
Yeah.
So anything when our central nervous system is just all ramped up from all the stress, whether we can't sleep or you're feeling anxious all the time, magnesium can be a good place to start.
Yeah, that's great. Really low risk, benign sort of treatment there.
Can I give this to my teens, my kids?
Absolutely. Yep.
Okay.
And you can do, like, even younger kids, a lot of times, like little kids in our practice will use powdered forms of magnesium that you can get, like magnesium glycinate powder. And even if you can't find glycinate, citrate is another option that's pretty good, and it's like well absorbed. Like Calm is a brand that you'll see over the counter where they have like this nice flavored powders and
the
gummies.
Calm powder.
Yep, yeah. And so that's a good place to start if it's someone like who's younger and can't really swallow a capsule yet.
Okay, so omega-3s, fish oil, we talk about this a lot. A lot of people might be thinking, isn't that for your heart, or isn't it for your brain, but I guess it's a little bit for everything. And why would making sure we're taking a good quality omega-3 or a fish oil be important for anxiety?
Yeah, so research again shows that people with low omega-3s are more likely to have anxiety, and then additional research has shown supplementation with omega-3s will improve anxiety levels in people who were deficient. So, I mean, we run omega-3 tests on a lot of our patients, and most of the time, unless someone's taking a fish oil supplement, it comes back deficient, like across the board.
Okay.
Even when people are eating like a couple of servings of fish a week, like even if they're like, that's a regular fish eater would be like twice a week, it's always low.
It's always low. And our body
low.
doesn't make these essential fatty acids, meaning that you might have to supplement. And it could be cheaper to do it this way than buying lots of fish.
Right, yeah, absolutely. And it's not a really high dose that's been shown to clinically be effective. It's between 1 and 2 grams of combined EPA and DHA. So this one has like, one capsule has a gram of EPA and DHA.
Gotcha.
Those are those 2 long chain fatty acids, and then 2 would take you to 2 grams. So that's the effective dose for anxiety treatment.
Okay, and if you're going to go again to a store, if you're not going to get it from Dr. Stagg at Whole Health, you do have a little store. People can walk in. You don't have to be a patient, right, to buy.
Yep.
But if not, then you like the Nordic Naturals brand?
Right, yep. So you can get Nordic Naturals pretty much everywhere, I would say. Whole Foods has it, and you could just look at the equivalent dosing on the label.
You don't want to get some of the other ones that you might see generic brands or at every other big box store, because it could be worse if you're getting a bad fish oil.
Yeah.
It's really bad for you.
Exactly. So you're probably worse off taking bad fish oil because it could be oxidized. That's bad for your system. It could, be contaminated with mercury. A lot of different contaminants have been shown to be present in some low quality fish oil. So you really want to invest in something that's good quality, and Nordic Naturals over the counter would be my favorite one.
Okay, so we got magnesium, we've got omega-3s, and now let's move on to, I guess,
maybe Bs. We should talk about B.
Bs. Okay, so B vitamins are important for anxiety.
Yep. So B, especially B6, has been shown to be like really helpful along with magnesium. So there have been some studies that have combined that for especially women with PMS. And have anxiety, that's a nice combination we'll use. And then we also would use, there we go.
There we go, yeah.
We would also think about that also for sort of like a stress type of profile. If someone's under a lot of stress, magnesium and B6 together work nicely.
So all of Bs do something different, but if you're taking a B complex, is that good? Or sometimes a B complex won't have the one
Yeah,
thing.
so a lot of times, usually we'll have B6 in there. This one has a lot of B6. This one has 200 milligrams, and this is a local company, Vital Nutrients. But you want to, most of the studies are about 50 milligrams. So sometimes your B complex might not have 50 in there, so you want to look for something with about 50.
And people will say, oh, I'm taking a multivitamin, I'm good. But multivitamins don't have enough of these kinds of things to affect mood, right?
It wouldn't have enough B6 in a multi.
It's more like a little insurance policy, so you're not deficient in things, but if you really need support, because you're noticing, especially women, right? When we go through hormonal changes, anywhere after 40, from perimenopause, menopause,
Big time.
anxiety and not sleeping can be a big big problem?
Yeah, for sure. So this is something like PMS, perimenopausal. The same thing I would say about omega-3s is that after a pregnancy, you get depleted of omega-3s, right? Because that baby is just like taking all the nutrition that you have. It's, you know, completely robs you of your nutrients.
Yeah.
So each subsequent pregnancy, it's been shown that you get like more and more deficient in omega-3s if you're not supplementing at a good dose.
Okay.
Yeah.
All right. So important to think about that. So these are more vitamins that, again, we can get. Just make sure you're getting high quality. The next step up is more herbal medicine.
Yeah. So there are a lot of really nice herbs for anxiety support. I probably would think about ashwagandha as if you have a mild anxiety picture. That, especially if there's associated stress with that. Another thing I didn't mention is that when we think about lab testing, cortisol, a lot of times we'll think about testing cortisol. If that's elevated, ashwagandha would be something really to consider there because it has been shown to lower cortisol levels and relieve stress and anxiety symptoms.
Yeah, cortisol is becoming more commonplace. You're seeing a lot of it on Instagram and lowering your cortisol and all of that. So you can get a cortisol test.
Yep.
Right through Quest. I know I've done this, and it showed I was highest in the morning, and so that would have made sense why I felt like in the morning.
Right. And you will naturally be at your highest in the morning. Like that's part of sort of the circadian rhythm of cortisol, but I think you were on the upper end of that.
I was in the red zone of like, so you don't want to do that. So, I mean, in addition, we can use some mindfulness, some exercise, stress relievers.
Of course.
But cortisol can be affected by an herb like ashwagandha, and you might be able to correct that.
Right, so that's a nice thing about herbs is it can have multi-layers of effects. So it's been shown to help with anxiety and helping relieve those symptoms of stress, but it's actually been shown to lower cortisol levels. And when you have high cortisol levels, that's not good for your body, right?
Yeah.
Like that can cause you to have like more abdominal fat gain, like difficulty losing weight, but also it affects how your genes even get expressed. So a negative pattern of gene expression, which we know that's not good.
Right, so we want a little ashwagandha, which has been used for thousands of years, super safe. This is standard process. That's it's a company online that has been around for a very long time, so you like that.
Yeah, so that's an American company, and they're actually the distributor for MediHerb, which is an Australian company that makes the highest quality herbs. They're very strong. So something like this, like one capsule a day of an ashwagandha of this type is actually a pretty good dose. Sometimes I'll put people on two, but sometimes I look at over-the-counter versions and it's just like it's not concentrated enough. This is like a 10-to-1 extract and it's in a high dose and just really good quality. So when you're buying herbs, you really want to be careful with herbs because there was a report that was generated by the Attorney General in New York a couple of years back, and he kind of designated this little study to look at herbal supplements sold over the counter, and they found most herbal supplements did not contain the herbs that said on the label. They had rice powder, house plants in there.
Oh no.
So a lot of times patients come in, they're like, oh yeah, I tried ashwagandha or I tried like kava or whatever,
and then
it didn't work, but they probably didn't actually try it if they're not buying really good quality.
If you are going to go out there, one brand you like that if you're watching this and you think, well, I want to get some sooner, I want to check it out, you do like the brand Gaia, and that we can find at Whole Foods.
Yes, they're a really good quality company based in the United States, and they have like excellent quality control.
And just start with the dose that they suggest.
Yeah.
It might say 2 caplets because it's it's a Whole Foods brand versus yours are a little more intensified.
Yeah.
Okay, but again, none of this is a prescription. It's just if you really, the gold standard would be having a naturopath actually run your blood work. But if you just want to try some ashwagandha, are you okay with that? Does it interact with anything you have to worry about?
Yeah, no, that's a really safe herb. So like even like teens, I'll often recommend ashwagandha for them. And it is one of these like classic tonic herbs that, has a lot of benefit. But
Just
it is
helps with
more
stress and anxiety.
for mild anxiety, I would say. If you're moderate to high anxiety, clinical practice, I find ashwagandha not really to do the trick. You do have to take it up a level.
Okay, so the next thing you have this hemp oil. And is that like CBD?
Yeah, basically, yep. So hemp oil is the full extract of the hemp plant, and then CBD is a component found in hemp. So a lot of times, sometimes CBD will be sold, obviously, like in just like a concentrated only CBD extract, but a lot of the research coming out is that you have more benefit in taking like the whole plant, and that it has, you know, broad effects, just like when we think about taking herbs. Like when you start concentrating just one ingredient, it changes the quality of the herb, and all those components are in there to achieve this balance that, you know, it's working on multiple different layers. So it's better to take like a whole plant extract.
Okay, so this is hemp oil, and then if you're so this is again standard process. The CBD is being sold everywhere, but same thing, you want to make sure that it's a good company.
Yeah, like this is actually grown in the United States on an organic farm. Like it's really good quality hemp. And with CBD, like there's not a lot of really big scale studies looking at it for anxiety. There's some preliminary studies that show, you know, it's promising for treatment of anxiety. I have some patients that we have used it for, and they have been really great responders, you know, like it works so well. And then other people are just like, didn't do anything at all. So it's one of those that you really kind of like have to try to see how it is for you, because there's no way of really predicting who's a good responder at this point.
Okay, and another, just herb number 3 here, we've got kava. Kava, I've certainly experimented with kava tea when you want to go to sleep. I mean, it's very sedative. It kind of knocks you out.
Right.
So kava, what is kava?
Yeah, so kava is a plant that comes from the Pacific, South Pacific, and it's used like in ceremony essentially there. So it's used by native cultures in ceremony. It has a lot of research for, you know, calming the nervous system. For just generalized anxiety, taking kava every day is probably not the way to use it. I find it works a lot better for more sort of situational anxiety. So if you're dealing with something that you're in the middle of a stressful situation for a period of time, yes, you can take it daily and even sometimes a couple of doses a day. But if you're just trying to get better control of just like long-term anxiety, kava is not my first choice there, but it can, again, like some people really, it's a good fit for their nervous system, but situational treatment is how we think about that. And sometimes we're layering these, right? Like we might have someone on ashwagandha, and then that is giving them good generalized control, and then when situations pop up, they have some kava to kind of like get them through that.
So even like with teens, if they're just really stressed about studying for the SATs or applying for college, or there's friend drama going on or something like that, having some kava in the house or something like that could help just take it down a notch? Yeah,
so that's like, this is in our house and we use it with our teens. And, and I'll take it sometimes if I want like a really good night of sleep. Like it is a really nice herb to take that you should notice a benefit from it.
Okay. And again, the thing is, if you take this, unlike some of the prescription meds, if you take it and you like it, great, or you don't like it, or it's not doing enough, it's not going to hurt you.
Right, yeah.
Okay.
Absolutely. These come with like such low risks of side effects, which is why they are available over the counter, right?
How long would it take if you want to try ashwagandha or magnesium, you know, maybe you do both, magnesium and ashwagandha to start out. How long are we going to take this before we notice a difference?
Some people will notice it, like, you know, within days of taking these types of supplements, but we usually tell people, like, at least take it for a month, 6 weeks to see how you are on it. Some of these studies, they'll study it in patients and go out like 60 days, 90 days and study it. Interestingly, magnesium was in a study with heart surgery patients, and just right after surgery they had them start taking magnesium, and so it was a 5-day study, and then they looked at the incidence of like how their sleep was, how anxiety levels were, and just taking this for 5 days, there was a significant difference in the patients who were taking magnesium. So it's not like, you know, it makes no difference like until like a month out. This is a 5-day study.
I think I was reading something else where that study where they went in earthquake ravaged places, and people were recovering from trauma, and they gave some people magnesium, some people not, and they recovered after Katrina and all that better. They reported less they all went through the same thing,
Right.
but they had fewer markers about the trauma and daily anxiety they were experiencing when they took the magnesium.
Yeah, it makes total sense, like thinking about the results from the heart surgery study. Yep.
Okay, so this is yours. This is Calm Stat, but really this is GABA. And GABA is one of those neurotransmitters, the way I understand it, that it's the calm transmitter.
Yes, exactly. So that's why we call it CalmStat, because it works also right away. So GABA is something, and you really have to get this form called PharmaGABA.
Pharma.
Yeah, pharma.
Like PHARMA, like pharmacological.
Pharma. Yeah, like
okay.
Yep. And that's better absorbed. So there are a lot of different like companies that do offer PharmaGABA, and that particular type of GABA gets into the system and absorbed a lot better. And this is what I'll often have patients use also for acute relief. So instead of Kava, like a lot of patients might use CalmStat, that tends to work across the board. And there is research on GABA having patients take, like this is typically a 200 milligram per pill dose. And there was a study where they looked at people over the course of 90 days, and people had like lower sort of emotional responses. They slept better. They even had improved heart rate variability, which is a really important measure of health too, and how your stress response is. But this can be taken, so it can be taken daily, but it's a nice like as needed type of supplement too.
Okay, so if you're going to take GABA, do you take it in the morning or you take it at night?
Yeah, so it depends on what you're trying to do. So if you were someone who gets like anxious in the evening and it's contributing to like your sleep quality, then take it in the evening. And sometimes like there are sleep formulas that will have GABA like built into it.
Yes, a lot of them do,
Yeah, and that's why. But you can take this during the day and it doesn't have like a sedating effect.
It won't make you sleepy.
No, like you can take this in the morning, you'll be totally fine.
Okay.
I even have patients who have like fear of flying, and instead of using a prescription, they find this to be like pretty effective, that they can get by with just using GABA.
So this is sort of like a nature's Xanax?
Yes, right, pretty much.
So GABA is something that
without like being fully sedated from it, you know, like you can still drive.
So GABA would be safe to give to teens too.
Yeah.
Is it okay? I guess you want to try all of this ahead of time, but if they're like going in and they've got a lot of testing anxiety.
Right, like I would give this to teens. I would recommend that for teens.
They could try it a little bit before the actual SAT morning, but like see how you feel
with it.
It's just going to help you. I mean, this is not, none of these are a magic bullet. You still want good sleep, good nutrition. Exercise can help with anxiety. I know lots of studies have said that exercise can beat out antidepressants, even brisk walks every day.
Yeah, absolutely. So you need to do like that whole like holistic lifestyle approach along with supplements, right? Because if you're just like relying on a supplement and you're staying up late, not getting good quality sleep, you're inactive and eating like a crappy diet, like
nothing's going to help.
You know, you're going to get better results when you combine this stuff together.
Yeah. Okay, so finally, this has been something, I've never tried this. I know a lot of people have heard of lavender for like an essential oil or lavender creams, but you have had a lot of success with your patients who have generalized anxiety disorder, and they take this product. Tell us about this.
Yeah, so this is a German product, and it's a really concentrated, specific extract of lavender. It's called Silexan. Silexan, and that's the active ingredient in here, and that has been clinically studied in a study that it compared it to a conventional treatment approach called lorazepam, so that's Ativan, if people are familiar with that medication, and it performed equally as well. So there was a 45% reduction in scores, like in the Ativan group and in the Lavella group, but there's no, with Ativan, you can have more sedative type effects from it. You maybe shouldn't even drive until, right? It's a pretty strong anxiety medicine. It's really reserved for patients who are having severe anxiety. And this performed equally as well, which is pretty amazing, without any of those risks of adverse effects from it.
So the reason you would take some of these supplements is just you're going to have fewer side effects. So something like this, if you take these lavender drops, clinically studied lavender oil, this is by Integrative Therapeutics. If someone wanted to find this online, could they?
Yep.
Okay, so one soft gel is the serving. The only ingredient here is English lavender. How long until you start noticing your anxiety dissipating with this?
Yeah, so I mean, in the studies, they typically did like a 6-week study. There was another one where they did 10 weeks. There was one where they did 4, and they were studying it either at 80 milligrams or 160, which one capsule is 80. And you know, this is where they saw those effects. But I have, in my practice, had patients like often start off with 2 if they have moderate to severe anxiety, and even mild. A lot of times I'll start them at 2 for the first month, but they often feel like it's making a difference, honestly, in the first week on it.
Okay. And teens, would this be good for teens?
Yeah.
Because one of the things we talked about, and you're not, a lot of people think, oh, naturopaths don't like medicine. That's not the case. You'll work with a lot of primary care docs and say, this medicine, if it's working for you, stay on it. But for teens especially, it's a little bit harder. Sometimes the SSRIs, I guess, don't work as well for them.
Right, and a lot of patients like fail medication for anxiety. Like the statistics show like almost 50% of the cases when you're on medication, you're not really getting like a lot of relief from the medicine. So this is why a lot of patients come to us, because they are looking for help because they're tried conventional medicine and it's not working, or if they're looking, they're not ready to go to that level because of risks, and certainly like black box warnings on SSRIs for teens. It could increase the risk of suicide.
Yes.
You know, it's a great option to try some of these natural products.
So in our final couple of minutes, I just want to give people action steps here. So if you're going to do something today, first of all, you don't have to live with that feeling of being anxious all the time, worried all the time, if you're not enjoying things the way they used to. That's called anxiety, and we can do something about it. And step 1, start with getting yourself a high-quality magnesium glycinate. Take that every night.
Yep.
Okay? Step 2, you would do...
I probably would add fish oil, because honestly, so many people are low in fish oil
So
that
maybe
these
get both
are
of
like,
these.
yeah, I would start with like basic nutrients. We didn't even talk about vitamin D, but if you have low vitamin D, I don't even have it in here. That helps with anxiety too, if you're deficient.
And a lot of us are deficient.
Which
if we're in New England, you would recommend, and that's, I didn't get into it as much because that's just part of the general wellness of that we should take vitamin D every day.
Yeah, but vitamin D is researched for anxiety as well.
Okay, so take your vitamin D and get some good quality magnesium. You can go, again, they can tell people where they can find you. I know you're on Instagram and have a website.
So our practice is located in Farmington, next to the Red Cross building, if people are familiar with that location, just off the interstate. It's called Whole Health Wellness Center, and we have a team of naturopathic physicians, so we're like available pretty quickly for appointments.
And you guys do take insurance. I know Dr. Stagg in general, her roster's a little full. You might not get an appointment with Dr. Stagg, but you have a whole team, just like if you went to a regular practice. So you'll tell people keep their regular doctor, but you're going to specialize in those lifestyle medicines, really precision medicine, helping fill in those gaps, especially if you're looking for help.
Yeah, for sure.
And my personal experience is I love my primary care. Hi, Dr. Papandra. But when you go to someone like you, you're generally going to spend a lot more time, and they're going to really do some testing. So you get that extra. You get a team. So only 30 seconds left, but here you go. If there's only one herb, I know you like the ashwagandha. That's just my review. If you or someone you love is suffering, definitely send this episode. We're on, you can listen to this podcast on your favorite platform, Spotify, Apple. Share this podcast with someone you love. If someone needs a little relief, there's some real solutions.
Yeah, absolutely.
Dr. Stagg, thank you so much.
Thanks for having me.
Have a great day, everyone, and be well. You can follow me on social media at Kara Sundlin. I do like to share links to this content there. Have a great day.